Welcome to Discovering Health, presented by Covenant Health Plainview. Your host for the show is Chris Moore, alongside various medical staff and health-related professionals. For the next 30 minutes, Chris submits the questions to the professionals that you have emailed in and discuss the topics that you want to know about. Now it's time for Discovering Health, presented by Covenant Health Plainview and Chris Moore.
Hey, good evening. You're tuning in to 103.9 FM, The Pulse. It's 5 o'clock, and it's time for Discovering Health, brought to you in part through the courtesy of Covenant Health Plainview. This is Chris Moore, and joining me with today's program is Dr. Joshua Rollins, orthopedic surgery specialist with Covenant Hospital Plainview. Dr. Rollins graduated with honors from Oklahoma College of Osteopathic Medicine and Surgery back in 2010. Dr. Rollins, thanks so much for joining us this evening.
Oh, thank you for having me here.
Man, great to see you. Man, okay, so just a little bit about you, your family, how long you've been in Plainview. Man, how did you end up in the Panhandle? You know, all that kind of stuff.
Well, that's a good question. I mean, this isn't a likely place for somebody to kind of land as an orthopedic surgeon. But
right.
After I graduated from residency, I was in Detroit, Michigan. A good friend of mine, Dr. Farr, he's already been here for 5+ years. We've been in contact since that time. We were friends during residency and trained at the same place. Mm-hmm. Actually, training in Detroit was very fortunate for us both because of the experiences that we had there in Detroit. As everybody kind of figures and knows, it's kind of a rougher town around the actual city. Now, did you have any General Motor experience as well? You know, pulling engines, kind of, working with bones, breaking. Well, working with bones and then working with wood and engines they go hand in hand.
Yeah.
I mean, that's what kind of drew me to orthopedics in the first place. Is I rebuilt old cars with my father growing up, and that was a passion of his and a hobby. And my first car was a 70 Barracuda, and so built it from the engine block straight up, put it in there,
right on.
And then that was my first car. So,
man, how cool!
Yeah, it was pretty cool. Got in a lot of trouble too, but nothing too serious.
Did you bring it here with you to the Panhandle here?
No, unfortunately, I had to sell that because I couldn't afford the gas once I got to college. It was pretty bad. But I mean, I got that car. And I got my license. We fixed it up. I took it for a drive. I went and did some cookies in the parking lot of the pool, and then the highway patrolman saw me and followed me home. So I got a ticket my first day with my license and my new car.
There you go.
Yeah, that was awesome.
There you go. Well, cool. Well, great. And so you're married, got kids?
Yes, married, 5 children. I have a 14-year-old daughter, a 12-year-old son, 9-year-old daughter, 5-year-old daughter, and 23, 22-month son.
Man.
So it takes me a second to go through the ages so I don't get them wrong.
Yeah. No kidding. Well, man, great. Well, thank you again for coming on the show with us. And, man, for those of you that are just joining us right now, what this is we go in and we take your emails. And what you guys do is you come in and you email us, askforyourhealth@gmail.com. We take those emails, we print those dudes off, and we're going to come approach the doctor, the nurse, the folks that work up at the hospital, whoever it might be, and deliver these questions and kind of see where it goes from there. So let's get going. Dear doctor, I have a slight dull pain in my right shoulder, and the doctor I went to said it was bicep tendinitis. I was wondering if I lift weights 2 to 3 times a week, in the long run, will my arm be badly damaged? My shoulder also pops when I lift my arm straight up.
Okay, well, that's a good question. Tendinitis in and of itself is just irritation of a tendon. Okay, so it's inflamed, it's angry, it's swollen, it's painful. If you continue to do those exercises while inflamed or you have the tendinitis, it's never going to recover. It needs time to relax. And so the best advice for that is that you've got to modify the activity, got to give it a chance to cool down and to rest. So you got to give it a break from the lifting weights for a little bit. Take some anti-inflammatories if you can, some ice to the shoulder, and then give it some time. And then ease back into activity again. Don't go full bore back into heavy lifting, but ease back in and do things the right way, and then it should resolve. If not, there's some things we can do to help with that also. Generally for a tendinitis, you don't require any type of surgery or anything like that, but we can also help with some physical therapy modalities and things that I can help with seen in the office. But generally, if you do that on your own, most of the time it'll take care of itself. But if not, I can help you if it's bad enough to where you can't do that.
Sure. So the key there, then, just take a break.
Yeah, basically, it's inflamed and angry, and it just needs to cool down a bit.
Yeah, I know. I've experienced it some. Play a little racquetball and some tennis and that kind of stuff, and I get it. The older I get, the more I get it in my elbow.
Well, I wasn't going to mention that, but that is true. A lot
about
of times,
how old I looked, or
well, maybe both.
Okay.
But, when you're older, you don't recover as easily as you do when you're younger. And so most of the time your mind is still 20, but your body is 40.
Yes.
And even though you think, man, I can still do the stuff I was doing when I was 20 in college and awesome, but your body just can't keep up anymore.
Yes.
And all that angry feeling and the soreness, that's your body saying, you gotta slow down a little bit here.
Sure.
I'm 40, and you gotta give me time. And so even going forward in the future, maybe less reps, lower weights, warm up adequately, take some anti-inflammatories before you work out, ice afterwards, things you can do during the workout also to help benefit yourself in the long run with that.
Okay, well, great. All right, so that's question number 1. Here comes our next one. Dear doctor, I've been having pain in the back of my leg when I walk, exercise, or work. I may have pulled something in my tendon. Is there some type of brace I can wear to relieve the pain?
Well, these kind of questions are always difficult because you're trying to diagnose something off of a question, which you have to bear in mind is a very difficult thing to do without actually seeing somebody.
Sure.
But from what it sounds like is that if you have a pulled hamstring, which would be the back of the leg area, those can be nagging type of injuries where they can bother you while you're exercising or doing activities. There's most of the time these things will resolve. Again, if you modify your activity, relax, let things heal up. Sometimes that's difficult. I mean, I understand as much as everybody. I didn't grow up a doctor. My first job was landscaping. I mean, I understand the world, and sometimes you got to work. You have to go to work. You have to do things, and so it's hard sometimes to rest it up because you have commitments you have to do. But the best thing to do is try your best to try to limit the things that aggravate it, and then take care of yourself when you're outside of your obligations like work and things like that to try to get it to heal up.
Well, it's like when I was growing up, I said, Dad, man, when I do this, it hurts. Dad, it hurts. He said, don't do that.
Yeah, he said, why are you doing that then? Stop.
Don't do that. Yeah. Right. And like you said, without being able to see the patient and know exactly what's going on, sometimes if it continues on, it's probably best, man, make an appointment.
Probably, you know, and that gets a little confusing for folks sometimes too, because with your insurance, you think it would just be as easy as, I'll just call and make an appointment, but some insurances require that you see your primary care doctor first and then get a referral from them. Others, you can just go straight and call our office, and so the best advice I have for that is if you're unsure is to call your insurance provider and just ask them, hey, can I make an appointment directly myself or do I have to go through my primary care provider?
Sure.
But to answer the last part of that question is really for if we are talking about hamstring pull or anything like that, there's not really a good brace to help out with that.
Just get off of it, rest it if you can.
Yeah.
There you go. All right. Before our break here, we've got one other question. Dear doctor, my husband tore his biceps tendon at the elbow, and it says a complete tear in parentheses. He's very active, but does not want to do the surgery to repair the tear. What are the pros and cons of not doing the surgery? Can he still build his biceps muscle with the tendon not attached? And this sounds like a concerned bride, and he's like, I'm not ready to go to the doctor. I don't even see that guy,
most of the time it is the female in the relationship that is more concerned about what's going on than the guys. I can tell you so many times couples come in and I've learned, I've been married 17 years, but then practicing now over 2 years, and I've learned you never bring your wife to the doctor's office with you. Not if you want to survive or you want to hide anything because it all comes out. It's all on the table, because then it ends up, she starts telling everything that's going on, and the guy's just sitting there folding his arms like, I don't even have to say anything anymore because she's taking care of it.
Doc's throwing me under the bus here, man.
Exactly. But with this, it's a good question. I can tell you from the literature, and that means like all the studies and tests and things have been done over a vast amount of people and all the other strength testing afterwards. The recommendations for fixing biceps tendon tear in the elbow area are reserved more or less for folks who are high-level athletes or folks who are heavy laborers. That would be more like your construction workers or folks who are lifting heavy things all the time. And by high-level athletes, I don't necessarily mean the weekend warriors. These are people who are very competitive in their sports or make a living in their sports, and those are really more of the indicated population of folks that should get it fixed because of the need of having that. Now, anatomically, the way that your body is made, With the biceps muscle itself, up in the shoulder, it has two tendons that attaches. One is inside the shoulder joint, and then the other one is on a bone you can feel on the front side of your shoulder. And those two tendons come into the muscle, and then at your elbow, it's one tendon. And so if you tear it up by the shoulder, you can get away with it okay and everything, and you'll be okay because you have two tendons. Now, you tear it down near the elbow, you can struggle a little bit because that tendon with your bicep, it controls flexion of the elbow. That means bending your arm up, and then also opening your hand up towards the sky. It's called supination, meaning like if you were to give somebody a high five, but you're the low five of the high five, and so that kind of motion, opening your hand up or flexing your elbow up, will be a little limited when it comes to that. So distally, we try to fix everybody that's there because you're going to have limited strength and everything like that. But proximally, then you start to make better calls about your patient population, if that makes sense. So I guess, long story short, if you tear it up by the shoulder, if you're a high-level athlete or construction worker, then we'll talk about fixing it up.
Right.
Or people who are really, really concerned about their cosmetic or cosmesis, the way they look, because when you tear it up by the shoulder or in the elbow, you're going to get what's called a Popeye deformity, meaning that you're going to have a big bump of muscle in your arm.
I've never had that problem.
Yeah, I mean, I guess if you're working out, then you expect that, but if not, but
right.
It doesn't hurt anything. So I guess to round it up for the question, tearing it by the elbow, you should get it fixed.
Okay.
Yeah, you should, because it's going to limit everything you did. And like I explained with the anatomy, you only have one insertion of the tendon down in your elbow where you have two in your shoulder. So you can get away with tearing the one in your shoulder and you're okay if you don't want to have the surgery. But by your elbow, there's only the one tendon. So if you tear that completely, you're going to lose a lot of strength.
Okay.
You just can't get around it.
Yeah. And the advice to the husband, just say, yes, dear.
Yes.
That's you got.
That's all you had to know. It was just one word. Yes, ma'am.
Yes, ma'am. Yes, ma'am. You got it.
Whatever you say.
Hey, folks, you've been listening to Discovering Health here on 103.9 FM The Pulse, brought to you by Covenant Health Plainview. We're going to take a few minutes to hear from our sponsors and come right back to have Dr. Joshua Rollins answer more questions sent by you, our listening audience. It's not too late to register for South Plains College Plainview Center Summer 2 classes, which start on July 13th. Summer classes include academic strategies, beginning and college algebra, renewable energy, vocational nursing concepts, and more. Financial aid available for qualified students. Make this summer the start of your new career. For more information, go by South Plains College Plainview Center, located at 1920 West 24th Street, or call 296-9611, extension 4302. Invest in your future with South Plains College Plainview Center. Don't let pain slow down your life. With our talented orthopedic surgeons, Dr. Joshua Rollins and Dr. Benjamin Farr, your future with pain-free movement is just around the bend. Providing advanced medical care in the comfort of your community, Plainview Orthopedics can help you regain your life. Rollins and Farr specialize in the full spectrum of orthopedics, from arthritis and joint replacement to bone fractures, sports medicine, pediatric care, and injections. Plainview Orthopedics, 806-291-5170.
Widening the focus on exceptional care, Dr. Douglas Kopp is bringing clear vision back to the South Plains. With unparalleled care and medical expertise, ophthalmologist Dr. Douglas Kopp and his staff are ready to assist you in your family's vision needs. Dr. Kopp cares for a wide range of patients from pediatric to seniors and specializes in cross-eyed, macular degeneration, glaucoma, and many other eye problems. Visit Dr. Kopp at 2222 West 24th Street or call 806-293-5156.
In-house, we have Dr. Joshua Rollins, orthopedic surgery specialist with Covenant Hospital Plainview. Man, you ready to go right back into it?
Let's do it.
Man, we've got questions. I'll tell you what, we've got letters here. All right, here we go. Dear doctor, I have a broken collarbone that moves and can be manipulated with no pain. Does not repairing the collarbone put me at risk for any shoulder problems? Will it make me more susceptible to a torn rotator or torn labrum?
Okay, multiple points or parts to this question. I guess part number one would be, does it cause any problems of the collarbone itself long term? Mm-hmm. Generally, if you don't have pain, you're going to be okay. Without seeing x-rays to know what your bones look like, if you're able to function normally and have no pain, then generally I think you're fine. Now, if your collarbone with the break or the fracture has changed the way that it is in your body, meaning if it's shorter or if it's lifted off in a certain way, then that can alter some of the strength in your arm or different activities that you can do because of the change in mechanics of the arm. Mm-hmm. But generally, I would say if it doesn't hurt and you can do what you want to do, I just leave it alone. Okay, part number 2, will it affect the rotator cuff? No, it shouldn't. Your rotator cuff comes from various muscles around your shoulder, most of them around your scapula, your shoulder blade, and then the tendons come around the front part of your arm, the upper part, and allow your arm to move. And they aren't connected directly to your clavicle or your collarbone. Mm-hmm. Same with the labrum. The labrum's inside the shoulder joint itself. It's not really connected to the clavicle per se, either directly where it should cause you any problems.
Okay, gotcha. And then just in listening to this guy's issues, it sounds like Houdini. I mean, you may be able to slip that stuff in and out, and so yeah, don't fix it. That way, if anybody ever cuffs you behind your back, you can flip it back over and be able to.
If anybody comes with a straitjacket, you're good to go.
That's right. All right, great. Next question. Dear doctor, I had an MRI done recently after a car accident, and it showed a complete mid-substance rupture of my ACL. I'm an athlete, and since my ACL has been torn, I have not been able to play the game to my full potential. Is this surgery necessary for my knee's recovery?
Technically, I always have to put that in there. Technically, you don't require an ACL to function normally. Mm-hmm. Okay, there are lots of folks, generally a little bit more seasoned in life, that have ruptured the ACL, and they're just going about doing their normal stuff every day. Now, a caveat to that are those who are athletes and love to play sports. All of the twisting, cutting maneuvers you're going to know because your knee's going to give out on you. And so younger sports folks, things, they should get it fixed.
Okay. Gotcha. There you go. Next question for the doctor. I practice a style of karate that involves a lot of body conditioning, particularly with the hands to make them hard and calloused. I recently heard that this type of training can lead to arthritis and loss of dexterity in the long term. Is any of this true?
Well, that's kind of a tricky question, I think. I'm not familiar with this type of martial arts, so making a definite comment is going to be very difficult because I don't understand what type of training there is other than using their hands a lot. So I guess it would depend on what you do, I guess, what it comes down to. If there's a lot of impact to the joints, meaning that, I don't know if everybody remembers the movie Remo Williams. That's way back from the 80s.
Mm-hmm. Okay.
So, but like he's like using his fingers and punching on a wooden board to like toughen up his hand.
Yeah, right.
So if you're doing that kind of thing, repetitively injuring the joints or like putting pressure on the joints, over long term, it could cause damage to the joints and increase arthritis.
Right.
But again, I don't know for sure, I guess, what kind of training is involved with that. But any repetitive use that damages the joint over time has potential to cause damage long term. Now, am I sitting there saying you should sit at home and be a couch potato? Absolutely not.
Right.
I say go live your life, do what you want to do. As ailments come or you have questions, we can help you out or try to fix you and get you going. But I would never, ever tell somebody not to do what they want to do or what they enjoy doing.
Sure. It wasn't it, speaking of movies, and karate and all the different martial arts, wasn't it Kill Bill where she sat there, man, and she punched that tree for so long, and man was toughening up her knuckles, I think. And
I think so.
I think that, not that I'm promoting Kill Bill. That's not what I'm saying, folks. I got to be careful when I say, something. I got up and spoke one time at a church, and man, I promoted this film, and I didn't mean to promote it. I was just using a scene from a movie to make my point. Man, I got hammered out. I can't believe you would say that.
Well,
But anyway.
I guess it depends if people like the movie.
That's right.
We were talking about Karate Kid earlier, and it's like the third one. When he's punching that wood dummy and making his knuckles bleed until he can. Same type of thing.
Yeah, same deal. All right, great. You're tuned into Discovering Health, presented by Covenant Health Plainview. We need to take a few moments to hear from the fine sponsors bringing you this evening's program right here on 103.9 FM, The Pulse. Surgical excellence is right here in Plainview. Dr. Yildiz and Dr. Raja with Covenant Health Plainview Surgical provides all aspects of general surgery to include abdominal surgery, surgical oncology, gallbladder surgery, appendectomy, critical care surgery, GI endoscopy, hernia surgery, and so much more. Professional and caring doctors right in your own backyard. That's Covenant Health Plainview Surgical. 806-296-7881.
Becoming a healthcare provider takes a special person. If you've ever dreamed of a career where you can make someone smile, keep someone comfortable, or soothe someone's fears, the Health Occupational Division at South Plains College can help open the doors to your future. With a stellar reputation for producing highly sought-after medical professionals, South Plains College is fulfilling the needs of tomorrow through its graduates today. And we provide our students with a quality education at an affordable price. Are you ready to make your dream a reality? Prepare yourself at South Plains College.
Great doctors are right here in Plainview. And leading the way are Covenant Health Plainview Family Medicine physicians Dr. David Wright, D.O., and Dr. Ruth Rector Wright, D.O. Serving the community for decades with care and compassion, the Wrights have strived to bring only the best care to your family. Visit them at the Covenant Healthcare Clinic located at 2222 West 24th Street or call 806-291-5100. Walk-ins welcome.
The Technical Education Division of South Plains College can help you get into a career in as little as 1 to 2 years. If you want to work in business administration, law enforcement, cosmetology, real estate, or the legal profession, a job can be yours in a short period of time. If your interest is in software development or network technology, that dream can become reality. South Plains College provides our students with a quality education at an affordable price. Explore these career opportunities and many more today. Prepare yourself at South Plains College.
We are taking questions with Dr. Joshua Rollins, orthopedic surgery specialist with Covenant Hospital Plainview. Now, let's get back to the questions. All right, Dr. Rollins, here we go.
Lay them on me.
My grandfather mentioned rooster comb injections. I'm 16 years old and have never heard that term used before. What in the world was he talking about?
Yeah, well, this is actually a funny deal. So,
I mean, is this like a cockfight kind of thing? I mean, what are we talking about here?
Almost. It's like, the best injection wins with this, but it really makes the patients angry, but love chickens. So the hens are happy.
That's right.
But
That's right.
So when these first started coming out, there's a substance in the rooster's cone that scientists found that could help lubricate a joint. So if you think of your knee as kind of like bearings, okay, so you have two bones rubbing on each other like you'd have two metal objects rubbing on one another, okay? So if you're talking machine work with metal parts and you have bearings, what do you need to make sure you apply it to the bearings?
You got to grease those beads up.
Yes, you got to grease the bearings. And so your body produces a lubricating substance called synovial fluid. So that's your body's grease, and you produce it normally. But what they found, as in this rooster cone, that this compound from there could be used to inject into the knee to increase the viscosity or the lubrication in the knee to help alleviate our signs of arthritis or symptoms of arthritis, not signs, but symptoms of arthritis. Now they don't do that anymore. It's genetically made. So it's genetically, that's incorrect. It's not genetically made. It is manufactured synthetically.
It's a synthetic now.
Synthetically made compound called hyaluronic acid. And so that's what we use now. It doesn't come from chickens anymore.
So if I'm a rooster, I'm a chicken farmer, and I've got a bunch of roosters I don't need, I can't bring them up to the hospital. You guys will take the comb off and maybe, I don't know.
Just scalp the rooster, bring him in, bring your food processor. We're good to go.
Try to make a little extra money. All right, there we go. Thank you, doctor, for that one. All right, our next question. My hip has been hurting a lot lately. What are some signs that I might need a hip replacement? I saw a YouTube video, and they used what looked like a big hammer. Do you guys really use a hammer?
Awesome. So with your hips can hurt in multiple places. Sometimes people say, my hip hurts. And when they are talking about that, then they point to the side of their leg. In orthopedics, that's not your hip joint. Okay, so if your hip joint is bothering you, it's in your groin in the front. It's not on the side.
Okay.
Which is a common thing. People come and say, hey, doc, my hip hurts. And they put their hand right on their hip, or on their hip. That doesn't help you out. Right on the side of the upper leg instead of in the groin. So if you have pain in the groin, that's most of the time coming from the joint. Pain on the side of the leg is usually more of like a bursitis. And a bursitis is a padding that your body makes to help tendons rub smoothly over sharp bones. And so you have some sharp bones on the side of your leg, and sometimes that bursa or the padding for the tendon can get inflamed and causes pain and discomfort on the side. So you should understand, I guess, what area you're talking about. So But if you have arthritis or pain in the hip joint itself, you're going to have problems with pain in the groin, like we talked about. There's going to be pain with sometimes sitting for long periods of time, especially when you get up to walk after. There'll be a lot of dull, achy pain that is alleviated somewhat after you walk for a while.
Sure. And you see this, right? You see this a lot in like truck drivers and people that, that sit for, 18, 20 hours at a time that are doing this kind of thing. So
yeah, things get stiff in there.
Yeah.
So arthritis gives you the same thing. As soon as you sit down and rest, swelling and inflammation, they kick up, and then it's painful to start moving again. But then generally, once you get moving, the pain alleviates a little bit, and so those are some of the things that you should look out for with that. Now, in regards to replacing the hip joint itself, we do use hammers. We have to. So it's par for the course. Now, a lot of folks will watch these videos on Google and I have to say, or YouTube or other things like that. I have to say you have to be careful what you watch, because you don't know where this is happening, or even if you're watching the same thing.
Right, it may not be in the U.S. even.
Yes, you may be watching a surgery happening down in Venezuela, and
third world country.
And it's somebody who's never done it before, and you watch it and go, man, is that what they do? Really, and that kind of stuff happens. They come and say, hey, have you seen this or that, and it's totally off base. So you have to be careful of the source a little bit. But yes, do we use mallets? Yes, absolutely. And with hip replacements, what's happening is you have two parts to your hip joints. You have like a cup portion, and that's in your pelvis. And then you have a ball portion, and that's the top of your femur bone. And so the ball goes in the cup, and that's how your leg moves around. And so when you get arthritis, it's inside the ball and the cup. And so you'll have two types of surgeries for your hip, for hip replacements. There's one called a total hip replacement, total meaning both sides. So we replace the cup and the ball.
Oh, okay.
So then there's a hemiarthroplasty, or partial hip replacement. That means we just replace the ball side. So it depends on your circumstance or what exactly is happening, on which type of surgery you get. Most of the time, if you come in and you're having arthritis, you get the full Monty. You get the total hip replacement. The hemiarthroplasties or the partial hip replacements are reserved for specific conditions otherwise than just your degenerative arthritis of the hip.
Okay, man, that's some interesting stuff. And like you said, you got to be careful what you look on YouTube. And
Absolutely.
I also, if I've got a mole or something that looks a little funny, I do not Google it, because man, next thing you know,
you can't sleep at night anymore. You're
dying.
thinking, oh gosh, I'm going to die next week.
I'm dying, man. I've got a red mole. Oh no. Well, great.
This is it. This is my will signed, right? I mean, got
this
everything
is it, man.
set up.
Life insurance is paid up, man. We are good to go. All right. Well, hey, folks, it's about time to wrap things up. I'd like to thank Dr. Joshua Rollins, again, surgery specialist with Covenant Health Plainview, for taking time out of his busy schedule to be with us. Man, thanks so much for being here.
Pleasure.
Man, I appreciate this. If you would like to schedule an appointment with Dr. Rollins, give him a call at 806-291-5170 or stop by his office located at 2508 Xenia Street, Suite 101 here in Plainview. I'd also like to thank each of you for tuning into this edition of Discovering Health, presented by Covenant Health Plainview. If you've got a medical question or concern that you'd like to have answered, drop us an email at askforyourhealth@gmail.com. For HPR Radio, I'm Chris Moore. Stay healthy, my friends.
You have been listening to Discovering Health, presented by Covenant Health Plainview, with host Chris Moore, and exclusively on 103.9 FM, The Pulse. Do you have a specific problem or question that you want discussed? Email your question to askforyourhealth@gmail.com. And listen in every Wednesday at 5 p.m. for Discovering Health, presented by Covenant Health Plainview. The information discussed on the show are for informational purposes only. The purpose of the show is to promote understanding and knowledge of various health topics. It is not intended to be a substitute for diagnosis or treatment. Always seek the advice of your physician or other qualified healthcare provider regarding a medical condition or treatment. Thank you for listening to Discovering Health on 103.9 FM, The Pulse.
Put your hat on and pull up your boots, because it's time for the 73rd Annual Rough Stock Bar None Rodeo, presented by the Plainview Rodeo Association. Saturday, July 15th, watch all the thrills and spills as Cowboys are put to the test of taming wild Broncos and Bulls in their quest to be the best. For the Little Rough Riders, there will be mutton busting contest, and for the Cowgirls, a Queen and Princess contest. Plus, purchase your raffle tickets to win some great prizes. The action starts at 7 p.m. at the Bar None Arena in Plainview. Tickets for age 11 and up are only $10, and those 10 and under are only $5, or they can get in free with canned good donations. As an added treat, there will be a parade Saturday morning at 10 a.m. starting at the Depot, featuring funny entertainers that will also perform during the rodeo. Don't miss out on the 73rd annual Rough Stock Bar None Rodeo, Saturday, July 15th in Plainview.
Let the